Okay, this is going to be an attempt to make a little journal about methadone withdrawal. I've been going to the methadone clinic for a long time, and it looks like I might not be going much longer due to lack of funds. And I want to sort of record the process of it. I don't know how it's going to go, how it's going to end, but I'll just get right into it. I've been going to the methadone clinic for like 12 years now, and long story short, I can't go no more. I mean, I've quit a couple times, tried to rehab, I took other pills on the street, it never worked out. I always went back. Here recently, you have to go, like, you're supposed to go every day. If you miss more than 2 days, they cut your dose in half. I was at 110 milligrams every day. I got cut down again the other day, and I just missed 4 days. I got cut down to 30 today. It was the first day I went in 4 days, and I'm still feeling the withdrawals. It's been over 2 hours now since I last took it, but I'm able now to at least start recording a little bit, making this journal. I'm going to try to make a video every day. I don't know if I'll be able to or not, because I can tell already that my mind still ain't right. I'm not only suffering from extreme physical withdrawals, which include diarrhea, vomiting, sweating, restlessness of the legs, hip pain, knee pain, joint pain, what they call bone pain. From when it seeps so far deep into your muscles, it feels like your bone hurts. But it also has mental side effects too, such as a fog over your mind. This is sort of like being in a little bit of a head rush constantly. You're still you, but you don't have as much sensory input. Your intelligence isn't as high. You certainly can't communicate as well. You have anxiety really, really bad. Depression, obviously. Antisocial, extremely. Basically a shut-in. You can't leave or do anything. You just feel like shit. Sometimes the mental pain's almost as bad as the physical, although the physical is by far the worst. One of the worst things about the mental pain are the nightmares. Like, I'm absolutely terrified to fall asleep when I'm in withdrawal pain. I mean, it is just, I don't even know how to describe how scary it is sometimes, these nightmares. The recurring theme is like losing your mind, going insane, losing control of yourself. Whether you're being chased by the cops and you're on a drug and you're starting to, lose your consciousness, or you're overdosing and trying to get to the hospital and you're starting to fall out, and it's a scary, scary thing. You're basically dying every time you fall asleep. And there's other themes to it as well, but that's probably the most common one I have. And it doesn't matter if you fall asleep for a minute or 10 minutes or an hour. It's all long enough to have a terrible nightmare. Starting to become extremely dehydrated because you can't hold anything down. You shit water and constantly sweat, and it's almost impossible to keep up with it. You really need to be on an IV under medical control, but it's so expensive to be in a rehab center, like $30,000 a month or something, or $3,000 a day. It's fucking crazy. It's just like a hospital stay basically. But oh man, I just kind of wanted to have this down somewhere. I'm probably not even going to remember half of what I say. I don't know how it's going to turn out. I don't know if I can find a job and at least start to go, a couple more days a week and slowly go down like that, which would be ideal. But, it's impossible to work when you feel like this. So it's like I find something part-time or some kind of hustle or score. I find it hard to believe that I'm going to be able to, get on my feet enough even to be able to work a part-time job here recently. So I don't know what's going to happen. I just started recording, and I guess we'll see how it goes. I know it's going to be an absolute living hell. I'm scared I'm not going to come back on the other side. I know if I do, I'll never be the same. Part of my soul is going to die. I feel real soon. Methadone withdrawal itself, opiates, it's a living hell. Per se, they say that can't kill you, but if you have pre-existing problems, it can. I have extremely high blood pressure, so if I have a stroke in the next few days, you can bet your ass it's from withdrawal pain. I'm taking medication, but it's still high. I just went to the doctor. They tell me to come back every week now. I'm on 4 different types of medicines, antidepressants, anti-anxieties. I gotta go ahead and have a ultrasound on my kidney tomorrow, or make an appointment tomorrow. They don't know what the fuck's up. My body is just fighting to stay alive, and I've got so many fucking chemicals rushing through my brain right now that I don't know, I feel like I'm in system overload or something. I haven't done shit for the past couple of days. I can't even get out of bed until today. I finally made up ready to take those 30 mils, which helped a little bit. It should help my digestive tract out enough to be able to rehydrate myself a little bit today. So I'll probably make another video tomorrow to see if I feel any better, but this is just an unscripted, unedited, confession of methadone withdrawal at its absolute fucking worst. This recording, it ends today, right now. See you on the next one, if there is one.